Hi all! Flytech Academy has come up with a new simulation video for you. Yes, this is the conflict management station where we are showing how to deal with an angry next of kin of an admitted patient. So enjoy your learning with Flytech Academy. Wish you good luck for all the nursing aptitude test aspirants.
Hi friends, today we are discussing a scenario which is one of the scenario stations in the aptitude test for the nurses in the Ireland. So in this situation, we have a family. The family is very much worried about the care which the resident is getting in one of the nursing homes. So in this situation, we are dealing with a situation how the nurse is handling an angry family member, and let's see how the nurse is managing the situation accordingly.
Hello, excuse me. Who is the nurse here? Are you the nurse here?
Yes, I am. How can I help you?
See, my mother. I am really concerned about my mother. Okay, my mother is here for a long time, but I'm not at all happy these days. My mother is not getting proper care. I'm really have so much concerns about my mother. I love my mother.
I know. Can I know your good name and which patient are you related to?
Oh, I'm Remya,
Okay.
and my mother name is Mary. She is in room
Okay.
number 14.
Okay, great.
Yeah.
So, Miss Ramya, is that okay that you can sit into my office and we shall have a chat, please?
Oh, is that compulsory to sit somewhere?
No, it's just because due to the GDPR, we don't want to be exposed in the public. Is that
Is it?
all right?
Oh yeah. Okay.
Please.
So now you have noticed that the nurse has invited the family member to the office chamber just to discuss about the patient details. That is because according to the GDPR, we are not supposed to disclose all the patient details publicly. So we need to maintain the GDPR.
Yes, Miss Ramya, please tell me, what are your concerns?
See, nurse, since morning my mother is starving and her breakfast tray was in front of her, but kitchen stuff is being taken away, that tray, and my mother was not taken any food from that tray, and she's totally dependent. You know that?
Yes,
And
I do.
I don't blame kitchen staff because they don't know what is the dependency level of my mother, but you know that. Would you let your mother starving like this?
I really apologize wholeheartedly. I apologize, Ramya, for the situation, what has happened. I'm so sorry. I know the food, your mother should have been assisted by somebody. The situation here is as well as a bit difficult.
Here, could you please explain why it is happening here and what's happening? I can understand that.
Ms. Ramya, we are actually short of staff, but I know that is not your concern at all.
Yeah,
And-
not at all.
Yes, I apologize for that. And whatever staff we have having today, we have been rotating between their residents. I know it is not your consideration. It's completely our fault, and I agree to that. And I apologize for what has happened today. I'm so sorry for what is happening. Please calm down. I will
No,
explain to you.
I'm okay. I'm okay. I can understand that you are short staff and all, but that you should talk to your management because my mother can't suffer like this. You know that, and I'm really concerned about my mother because I'm a full-time worker and I can't take care of my mother at home. That's why.
So the nurse is actively listening to the family's concern, and she is maintaining an eye-to-eye contact with the family member, and she's listening exactly what the family member is saying, and then she is giving the explanation to that. In this video, the nurse is not interrupting the conversation between the family and the nurse, and the nurse might have explanations to give to the family member, but she is not giving the explanation, but she's just waiting the family member to finish their concerns to explain, and then she's responding. So you might have noticed that the nurse has provided water to the family member just to make her more comfortable. By making the environment comfortable, the communication will be much easier.
So nurse, anyway, I'm not happy with the situation. What happened to my mother? I want to know what are you going to do to deal with this situation? Is my mom gonna starve till lunchtime?
Oh, not at all, Miss Ramya. I will make an arrangement for another tray as soon as possible. And
What is the arrangement you can make it?
Yes, I'm going to give an order into the kitchen soon, and I'll also assign another staff to assist your mother with the feeding. And this will be done every day. This was just a very unusual situation today. Hereafter,
How I know every day it will happen? Because today I came, so I knew that.
at the moment, I'm going to order another tray in the kitchen, and one of our staff will be assisting your mother with the feeding. And hereafter, there will be a staff always assigned to take care of your mother with the feeding and the other rest of that care to be assisted as well. You please don't worry about it. This was
I'm worried. I'm worried because it's my mom. You know that it's my mom. I love my mom.
Yes, I understand your emotions very much. I understand very well. And so hereafter, we will always have a staff assigned to take care of your mother, and that will be recorded. And also it will be recorded in the care plan for all the staff to make sure that this is the type of the care your mother requires. So we will also ensure that this communication is passed on through all the staff here, and it will be given through the handover as well, so that the day and night staff will be aware about your mom's care. Is that happy to you?
I don't know, but actually I don't know. I'm not happy at all. And like tomorrow, it might happen again. My mother will be starving tomorrow. How you can make sure that, it won't happen like this?
Yes, Ramya, and that is the reason what I have been explaining to you, that we will record it in the care plan, so that even if a new staff arrives, she can look through the care plan before the care is provided. And also we'll communicate it to all the staff during the handover, so that there's no miscommunication, and your mother will be getting the proper care hereafter. So I assure that it will be provided to your mother hereafter without any delay.
In this situation, the nurse has offered a current solution. That is, the nurse informed the family that she will be ordering the food from the kitchen immediately, and she is going to assign one of the staff to assist the resident. Also, she has made a future plan so that the documentation is mentioned in the care plan, so all the staff members can go through and plan accordingly. Meanwhile, she is providing the reassurance to the family member so that it won't be happening anymore. In this situation, the family members still had more concerns at the end of the conversation. So the nurse has provided the further more clarification. If she wants to talk to the clinical nurse manager, she has provided the protocol how to approach the clinical nurse manager. So at the end of the conversation, the family was happy with the future plans, and she is not going through the clinical nurse manager for the further concerns. So she is happy with the plan. Just in case if the family member wants to raise a complaint, the family member can approach one of the staff nurse. So the staff nurse will give the complaint form, and the complaint form has to be filled by handwritten, and the family member can hand over that to the clinical nurse manager, and they will form an investigation team in the nursing home or in the setting, and they will investigate within the setting. So once the findings are ready, the clinical nurse manager or the investigation team will contact the family, and they will update the family.
Hi friends, so we hope that this video has been beneficial to you. It is one of the important aptitude scenarios that has been asked during the aptitude examination in Ireland for nurses. We will be coming up with more videos and more information regarding aptitude test, and Flytech Academy will be very happy to help you out. So you can see the description box for the contact details, just in case if you need any help, or if you would like to be trained for the examination, for the RCSA aptitude examination, we are ready to help you. So contact details will be given.